My name is Dr Srinivasan, and I'm a neurosurgeon in Seattle, Washington. As a neurosurgeon, I take care of conditions that involve both the spine and the brain. In the brain, I take care of brain tumors. I take care of patients with arteriovenous malformations. I take care of patients with conditions such as trigeminal neuralgia and Chiari malformations. In the spine, I treat all types of spinal conditions, including arthritic conditions, degenerative disc disease, herniated discs, and tumors in the spine. My clinical interests include two different areas in the brain and spine. In the brain, I am very interested in brain tumors and skull-base tumors. I've had extensive training to treat those diseases. In the spine, I'm interested in degenerative conditions as well as spinal tumors, and I specialize in both minimally invasive and complex spinal surgery. My practice is unique because I'm focused on the care of my patients and the individual patient and their individual needs. I take care of my patients directly. We don't have nurse practitioners. We don't have physician's assistants. I see every patient. I answer all my phone calls, and I answer them quickly. And I give each patient the attention they need and as much time as they need to feel comfortable with their treatment. I think that all treatment is directed not towards a disease, but towards an individual. And the individual is not just whatever condition brings them in, but who they are and what's going on in their lives and how soon they need to return to work and what other factors are involved before you can make a treatment plan. I balance it by focusing on each patient individually. It does take up a lot of time for me, but I've done this for a long time, so I know what patients need and what I can offer them and how much time each person needs to make them comfortable with what they're having done. I spend a lot of time with my patients explaining what they have and what their options are and how each option may work or may not work. And I want the patient to come to the decision with me as to what course of treatment they want to pursue. I don't want to tell them what to do. I don't want them to just pick a treatment because it sounds good. I want them to pick the treatment that they feel comfortable with and will give them the best outcome. I enjoy interacting with my patients. I think that it is important to understand that everybody has a different need as to what is going to help them. There are people who are very afraid of surgery. There are people who want surgery right away. There are people who want to know everything. There are people who want to know nothing. And I think it's important to recognize that in the individual. If I have a nurse practitioner or a physician's assistant see my patient, I won't know what the patient actually wants. And I want to do what's best for them, but is also what they feel comfortable with. When I was in college, I actually did research in neuroscience, and then when I went to medical school, I really didn't have an idea of what I would do. But as I learned more about the brain and about the nervous system, I became so interested in the anatomy that I wanted to help people with neurological conditions, and that's how I ended up in neurosurgery. To me, it's still a field that's so unknown and so fascinating that it keeps me interested. And the changes in care, the advances in care that happen over the years have been very exciting, both for the patients and for the physicians treating them. My interests in neurosurgery are primarily in two different areas. One is in the area of brain tumors and skull-base tumors, and the other is in the interest of complex spine and minimally invasive spine. And my practice is quite extensive in encompassing both those areas. It's exciting to treat patients with neurological conditions because I have the chance to make somebody's life better, to make their quality of life better, to help them live longer, and to function as well as they can with whatever disease condition process they have been given. I love my job. I think it's interesting, and I like people. I like to get to know my patients, and I like to hear about their lives. And if I can help make their lives a little bit better, that means a lot to me.